Good morning, everyone. On behalf of Center for Catalyzing Change and Center of Gender Impact Study Center at IMPRI Impact and Policy Research Institute, Prabhav Evam Niti Anusandhan Sansthan, Nai Delhi, I, Ritika Gupta, Assistant Director at IMPRI, welcome you to IMPRI hashtag Web Policy Talk. Today, we have gathered here for the release of study finding Rural Telephonic Time Use Service Study in Bihar, Life in the Era of COVID 19, Impact on Village Makers of Bihar, and Future Prospects. I would now like to welcome our moderator for today, Dr. Simi Mehta, who is CEO and Editorial Director at IMPRI. Ma'am, over to you.
Thank you so much, Ritika. You have made my task easier. Good morning, everyone, and best wishes for everything in 2021. Happy New Year. I am Simi Mehta, and along with Ms. Madhu Joshi, who is Senior Advisor, Gender and Governance, Center for Catalyzing Change, we would be moderating the program today. Madhu ma'am, we are not able to hear you.
Yes. Hear me now?
Yes.
Sorry about that. Good morning, everyone. On behalf of Center for Catalyzing Change, I extend a very warm welcome to everyone for this very exciting and very important study that has gathered primary data through a rural telephonic time use survey. Very interestingly, our data collectors were these bright students, and the study was conducted in collaboration with Impact Policy Research Institute and Center for Catalyzing Change with generous support from the Bill and Melinda Gates Foundation. I congratulate all the researchers and look forward to hearing from them today.
Village makers, who are the village makers? It is actually a new word in the lexicon of scholars and coined by none other than Dr. Arjun Kumar, Director of Impact and Policy Research Institute, that actually reflects the enormity of the role that has been played by women and continue to be played by women of the villages and in the villages. Often relegated to the sidelines of the state-of-the-art healthcare benefits or educational attainment, economic participation, and opportunity for political participation. They are these women who are the key agents who have sustained the wheels of lives and livelihoods in the villages. It is these women who are the wonder women who have borne the brunt of the deeply entrenched systemic patriarchy, yet stood firm, faced the challenges head on, and they continue to play the indispensable role towards rural development. Hence, it is appropriate and essential to accord the long due credit to these women of rural areas by hailing them as the village makers.
Now invite Dr. Aparajita Gogoi, Director of Center for Catalyzing Change, to deliver the opening remarks for this very important web policy talk. Dr. Gogoi has headed not just Center for Catalyzing Change, but also the White Ribbon Alliance for Safe Motherhood in India, and is a leading national and global advocate for women's rights and young people. Welcome, Dr. Gogoi. Over to you.
Thank you, Madhu, and welcome everyone. I'm really proud and privileged to be part of the dissemination today. I think for people who are gathered here today, we don't even need to talk about, why did we do the survey with IMPRI. But I think, all of us are increasingly becoming very aware of the fact that, women are making vital contribution to tackle the COVID-19 pandemic, the lockdown, etc., as frontline health workers, as community volunteers, nurses, doctors, scientists, and even as caregivers at home. I think most of us have experienced that how, and as you've seen from studies and data, that this pandemic has increased women's care work burden, and even for women in the formal sector who are now working from home, because in most families, gendered expectations put the responsibility of household work solely on women, like I said, in most cases. There's increasing amount of kind of discourse and conversations about the gendered impact of COVID-19, about women losing livelihoods, especially women in the informal sector. We have seen data which talks about curtailed access to sexual and reproductive health services. The reported rise in domestic violence due to the crisis have also affected kind of women's well-being. In the early days of the lockdown, we saw reports of national helplines talking about a twofold rise in gender-based violence-related complaints. Along with women, children are also being impacted. Again, early days of the pandemic, we saw distress calls from children increasing by over 50%. And all of us have seen the UNESCO data, which talks about, the lockdown and the closure of schools, college, universities in, 163 plus countries, how it is impacting more than 1.4, 1.5 billion young people. I think past experiences also show that school closures, such crises, including family going into poverty, really increases a girl's likelihood of dropping out of school, escalating chances of early and forced marriages, sexual violence, etc. And that's why it is so important that we are here today and that the survey has been done, really how to understand how COVID has affected women, particularly rural women or village makers, as the survey designates them. And we know that such findings in the recommendation is really essential to design an inclusive intersectional recovery programs as we seek to rebuild stronger from this crisis. I want to echo Madhu's words. We are very glad for the opportunity that we had to partner with IMPRI through our C3 Saksama initiative. And today we're going to talk about the findings of the telephonic time use survey in the rural areas of the state of Bihar. I think about 1,039 village makers from all 38 districts in the state were spoken to. But I really want to end by talking about, the data is going to give us findings, but we really need to kind of work on the recommendations, build on the recommendations of such research so that we are able to initiate actions, talk about how do we prioritize investment in basic infrastructure and public services in remote areas, especially to support women's health, well-being, productive, uncared fair work, and domestic work. This would also mean going into the arenas of strengthening their access to sufficient and affordable water, sanitation, hygiene services, electricity supply, etc. And lastly, as we seek to rebuild from this twin health and economic crisis brought about by the pandemic, I think it's extremely critical that we ensure the active involvement of village makers in decision making within the families and households, within the community, and as well as in the planning and implementation of programs that aim to positively impact the lives. I think all of us will agree that women are among the hardest hit by the pandemic, but we also recognize that they will be the backbone of rebuilding efforts if we are able to leverage their leadership for socio-economic recovery. In fact, going forward, my recommendation is that we foreground women's voices so that we take this also as an opportunity to create a more equitable environment that will be resilient and will be able to withstand further crisis better. So I'd like to end by thanking the IMPRI team led by Dr. Simi Mehta and Dr. Arjun Kumar for spearheading this research project. Thank you to the students who did the survey, and thank you to Bill and Melinda Gates Foundation for their support to the Sakshama initiative. So thank you everyone for joining us and looking forward to the findings. Thank you.
Thank you,
very
Dr.
much.
Thank you for your for setting the stage for the release of the study findings. I now invite the IMPRI team to share what we are all waiting for this morning. Thank you. Over to the IMPRI team.
Thank you very much, ma'am. May we have the permission of the chair, Dr. Nivedita Haran, who is joining us. We are so fortunate to be joined by Dr. Nivedita Haran, who is the former additional Chief Secretary, Department of Home Affairs, Government of Kerala. Ma'am, may we begin with the presentation?
Thank you. Yes, please do. I'm looking forward to it. Although I must apologize to Dr. Arjun and to all of you that it was a very last moment confirmation from me, but I truly am looking forward to it and I hope to learn something from it and I will have my suggestions on it later perhaps. Thank you. Go ahead, start.
Thank you, ma'am. Yes. Ritika, over to you.
Yes, thank you, ma'am. So just to set the tone of the presentation, I would like to start with the fact that South Asian nations have high and persistent gender inequality in the world. Here, majority of population live in rural areas and primarily dependent on agriculture. In this study, village makers are referred to as rural women who are the key agents of rural development, but their work is under-recognized due to prevailing patriarchal norms, lack of initiatives and opportunities for leadership. India is no exception in this case, where women are paid unequal wages for equal work and thus continued economic dependence on men. COVID-19 has increased the problems manifold with increased cases of violence and unpaid household work, which are obnoxiously considered as feminine duty. Women's health have been compromised due to non-availability of Anganwadi workers and ASHA workers. The societal demons of child marriages and child labor have increased. Phenomena of school dropouts and debt trap have also been observed. While specifically talking about Bihar, our national statistics have also shown maternal mortality rates, infant mortality rates, and the rates of child marriages have increased in the state. Even some national studies have shown unavailability of sanitary napkins and contraceptives have jeopardized the women's health. This is general statistics. Thus, taken into account all these indicators, IMPRI, along with Center for Catalyzing Change, Sakshma Initiative, undertook a study, Life in the Era of COVID-19, Impact on Women, Village Makers of Bihar, and Future Prospects. The main objective of this study was to provide evidence-based understanding of the impact of COVID-19 on the life and livelihood of village makers. We, we covered the study in the following uh, aspects: livelihood and women participation in paid and unpaid work, their access to land, house, livestock, and resources, their access to healthcare facilities, access to amenities such as water, sanitation, fuel, access to education, violence and discrimination against women, and the impact of COVID 19 on these indicators. We adopted snowballing method in this study. We reach student researchers, faculty advisors, local NGOs, community leaders, coordinators, and volunteers to get the contacts of village makers. We also used official data of ASHA workers, NGO list available with Niti Aayog, Darpan, list of Gram Panchayats, and we gathered contacts from academia together the contacts. Limited physical visits were made with precautions. Telephonic interviews were conducted. After the pilot training, we incorporated all the comments to develop the final question. The study was conducted in the month of September and October. The questionnaire is divided into 6 parts: background information about the family well-being, time use on a normal day, life in the era of COVID-19, government welfare measures, perception, and aspirations. The study interviewed about 1,039 respondents. After cleaning the data, we came across 844 respondents. We have covered all the 9 administrative divisions of the Bihar and 38 districts of the Bihar. As you can see, we have the division-wise sample size of the study on the slide. I would like Tanya now to take the presentation forward. Thank you.
Good morning, everyone. I am Tanya, and I am a final year Masters in Economics student at Ashoka University. I'm joining from Muradabad, and now I'll start. Starting from the profile of our respondents, as you can see from the presentation, 17% of our respondents are below the age of 30. 72% of our respondents are below the age of 30. 72% of our respondents lie between the age of 31 to 49, and the rest 11% are above the age of 50 years. 89% of our respondents were married, and the rest 11% were either unmarried, deserted, widowed, or single women. Majority of our respondents belong to the scheduled caste. 30% belong to scheduled tribes, and 20% belong to other backward classes. As we move to the next slide, we see that 1/10 of our respondents are illiterate. 34% were educated up to middle school. 39% had an education up to higher secondary school, and only 16% had completed graduation and further studies. 30% of our respondents who belong to scheduled tribes, half of them were illiterate, and only 3% had completed graduation or further studies. Next, we move to basic amenities. like drinking water, we found out that majority of our respondents used hand pump followed by tap. 87% respondents from Patna and 85% from Bhagalpur has access to drinking water within their household premises, while only 32% of respondents from Magadh had access to drinking water within their household premises. 80% of the respondents belonging to other social groups had drinking water facility within their houses, while respondents belonging from scheduled tribes, it was only 62%. 80% of the respondents had a toilet facility within their houses, while only 13% reported open defecation. Almost 90% of the respondents from rural Patna and Kosi had a toilet facility within the household premises, while 38% respondents from Magadh and 24% from Saran were defecating openly. Respondents who had drinking water facility within the house, 91% were using a toilet facility within the house. Among respondents who did not have drinking water facility, the percentage of people having toilet facility fell to 50%, with 35% reporting open defecation. Now, as we move to the next slide, we see 60% of the respondents were using LPG, 36% were using wood, coal, or cow dung, and 4% were using kerosene. When asked for reasons for not using LPG, 40% of the respondents said it was costly. Now, as we move to the next slide, we see that 58% of respondents have a healthcare facility within 2 kilometers of their residence. From the analysis, we found out that 25% of respondents belonging to other social groups visited a private hospital as compared to only 10% of scheduled tribe respondents, From our analysis, we found out that during menstruation, 56% of our respondents used cloth, while 44% used a sanitary pad. 68% of the respondents who are above the age of 50 used cloth. Half of the respondents between the age of 40 and 49 used sanitary napkins. The percentage of respondents using sanitary pads increased with education level. 50% of the respondents with a toilet facility within the house use sanitary napkin compared to 33% among those using a community toilet and 10% among those defecating in the open. Thank you. Now I would like to invite Sunidhi to present the next section.
Hello, very good morning to everyone. I am Sunidhi Agarwal, joining from Jamshedpur, Jharkhand. Talking about the land and agriculture section, it can be seen from the pie chart that 60% of the respondents' households own land, while 9% had rented land and 32% did not even have land. Among those 60% whose families own land, almost half had marginal holdings, meaning less than 0.25 acres, while 1/3 had small land holdings, which is between 2.5 to 5 acres. An interesting point which should be noted here is that almost 50% of scheduled tribes respondents' households who own land had marginal holdings. Coming to the second part of the section, which is the status of payments for farming produce, it can be seen that 40% respondents received lower than the market price, which is the yellow part in the bottom section. And among divisions, 61% of respondents from Bhagalpur were receiving payments at lower than market price for their farming produced, which was followed by Saran and Purnia. Secondly, almost 30% said that they were getting delayed payments, which is the orange part in the bottom section. And among divisions, 47% of respondents from Munger reported the same, followed by Darbhanga and Patna. Next slide, please. Coming to the work and livelihood area, working class category, which include casual labor, salaried, and self-employed, constituted 65% of the respondents, while 35% were housewives. Among those 35% of housewives category, 30% and 20% respondents belong to the OBC and scheduled caste social group respectively, while 40% each of scheduled tribes and other social group respondents were housewives. Talking about the working class category, which constitutes around 65% of the respondents. Coming to the first working class, which is the casual labor, it constitutes around 30% of the respondents. But among scheduled tribes, the percentage goes up to 58%, which is pretty much expected. and it is then followed by scheduled caste, OBC, and other social group. Then coming to the second working class, which is the salaried class, it constitutes around 40% of respondents. And it should be noted that the survey covered many Anganwadi workers and Sahikas. Hence, 25% of respondents are salaried. Moreover, almost 50% belong to the other social group category, which is followed by OBC, SC, and ST. Coming to the last and final working class, which is the self-employed category, it constitutes around 32% of the respondents, and under which almost 35% of the respondents said that they belong to the OBC social group, which was followed by other SC and ST. Talking about the engagement in non-farm activities, which is the last section of work and livelihood, it can be seen from the graph that almost half of the respondents were engaged in services as their non-farm activity, followed by self-employed activities and others. Next slide, please. Talking about the income and debt section, almost 50% of the households said that their yearly income was less than rupees 50,000, while 1 out of 4 people reported to have a yearly income above rupees 1 lakh. And the highlighting point is that even under this 50% bracket of yearly income, which was less than rupees 50,000, 75% were casual laborers, while only 35% belonged to the salaried class. Moreover, when we observe with the help of education background, out of those 25% respondents whose yearly income was above rupees 1 lakh, 35% holds a graduate degree. Talking about the debt area, 53% of the respondents said that their family was under debt. And the points that should be noted here is that under this 50% bracket, families of 75% of scheduled caste respondents were under debt. And as we know that self-employed need most of the finances, hence 75% of self-employed respondents reported that their families were under debt. As you can see from the graph that 30% of each of respondents borrowed from landlord, relative, or friend, and from a commercial or rural bank and cooperative society. And a striking feature is that majority of the households whose yearly income was above rupees 1 lakh borrowed either from a commercial bank or rural bank or a cooperative society. And on the other hand, respondents with yearly household income below rupees 50,000 had borrowed from a landlord or relative or their friend, which shows that there is a very less formal banking opportunity available in Bihar for the people with lower income. Now the presentation will be taken over by GB. Thank you, everyone. Thank you.
Good morning, everyone. I'm GBAT, joining from Kanyakumari, and I'm a second-year undergraduate in Economics and Finance at Ashoka University. In the Time Use survey, respondents were asked about the activities they were involved in at different hours of the day, namely morning, afternoon, and evening. Even though the sample was slightly small, we have tried to analyze and cull out some findings from those responses. Grouping the respondents in 4 occupational categories: casual labor, salaried, self-employed, and housewives, we observed differences in the time use in terms of productive work and unpaid work between respondents from different categories. Next slide, please. A detailed analysis of this can be found. Previous slide. A detailed analysis of this can be found in our report, and the activities that we have listed follows the ICATS division with the SNA typological matrix. Next slide. So empowerment and agency of women is imperative for a reduction in poverty and gender inequality. It increases their right to economic resource and power to make decisions that benefit themselves, their families, and their communities. Not surprisingly, we found male supremacy in household decision making. Only 36% of the Bihar women respondents report that both men and women in their household take financial decisions. Illiteracy and lower income are spaces where men grab greater power. On a positive note, 48% of the respondents reported that decisions regarding children's schooling were taken by both men and women. Working, educated, and older women reported that lower proportion of men alone make decisions. In terms of ownership, there is a disparity in the ownership of farm equipment and livestock. However, a good 70% report that both the genders have bank accounts. Next slide, please. Rural women in Bihar express hesitancy to disclose facts about sensitive topics like violence and discrimination. Despite this, more than half the respondents nodded to the presence of domestic violence. The observed trend is that women who feel independent and empowered personally based on financial and social circumstances had admitted to domestic violence being prevalent in their community. For instance, while 71% of those with an annual household income above 1 lakh report violence, only 46% those with annual household income less than 50,000 report domestic violence. A similar trend can be observed in terms of those who report discrimination based on untouchability and caste. Next slide. So we all are aware of the employment crisis that resulted from the pandemic and the lockdown. In Bihar, unemployment of casual laborers, as reported by the respondents, stood at 72%, and 75% of the respondents reported reverse migration. Additionally, a fall in wage rates has been registered by 80% of the respondents who had lower levels of education. However, a good 60% respondents report having found alternative means to sustain their needs, thereby coping with the crisis. Concerning the wage gaps, while the respondents acknowledge the existence of wage gap, 42% of the respondents saw it as a norm of life, and this tendency is more prevalent in women over the age of 50. The inequality is explicit, nevertheless, the inclination to justify it is common in rural Bihar. And next, I would request Reena ma'am to continue with the slides. Thank you.
Good afternoon, everyone. Bihar. Now, look at the government linkages. During the survey, respondents were asked about their awareness about government policies like Manrega and insurance scheme. So, in this survey, we found that 66% of respondents engage in casual labor and they didn't have Manrega card. 21% of them they do not have voter ID, and 90% of them have not an Aadhaar card. When we look at the ration card, they have asked about they are having a ration card or not. Among the 5 out of 6 respondents possess a ration card. Around 60% of respondents had BPL ration card followed by APL, Antyodaya Ann Yojana, and other ration card possess 24%, 11%, and 5% of respondents respectively. Among the 9 divisions, Magadh had the highest percentage of BPL ration card holders, and that was around 77%, followed by Bhagalpur and Patna. Among the social groups, 69.2% of SC respondents had BPL ration cards, followed by OBC at 64.7%. 66% of respondents engaged in casual labor had BPL cards, followed by 62%, 61%, and 15% of housewives, self-employed, and salaried respondents, respectively. Look at the government relief packages during lockdown. 3 out of 4 respondents reported having received the benefit of relief packages by the government during lockdown. 76% of respondents between the age of 13 to 39 had received the benefit, while 74% of respondents below the age of 30 received them. Social group wise category, with 3/4 of respondents having received the benefit. 4 out of 5 graduate respondents received benefits. The percentage stood at around 75% for both those educated up to higher secondary and those educated up to middle school, and 71% for respondents who were illiterate. Among occupation groups, 83% of self-employed respondents reported having received benefits, followed by 78% and 77% of salary respondents and housewives respectively. In comparison, only 61% of respondents engaged in casual labor reported receiving benefit. 68% of respondents with early household income above 1 lakh received the benefit of the relief package by the government during lockdown, highest in comparison to respondents of other lower income group. Please, next slide. Uh, During the survey, respondents were also asked about the reasons for not having crop insurance. It is very surprising to know that around 23% of respondents are not aware about crop insurance, while 62% of them do not have it. 16% of respondents were telling that the procedure is very complex. 14% of them were telling that lack of resources for premium payment. 11% were saying that nearest bank at a long distance, and 9% of them were not interested. And so many and respondents are also saying that they are not satisfied with terms and conditions, insurance facility not available, delay in claim payment, and delay in procedures. So look at the awareness of respondent about the program. 28% of respondents reported that they were unaware of the PM Kisan scheme. 18% of them were unaware of Women Jan Dhan scheme. 31% of them were aware of increased Manrega wages, that is 202 rupees per day, and provisions to pensioners. Now there is need to give assistance. 66% and 44.5% of respondents engaged in casual labor reported they require work and ration respectively. 50% of salary respondents require cash transfer. So I hope.
Yes, thank you.
Right. Thank you. I'm Anshula, Assistant Director at IMPRI, joining from Delhi. So delving further into the impact of the pandemic and lockdown on the village makers of Bihar, some of the other aspects that were evaluated were the time spent in household tasks, deprivation and necessities, the precautionary measures they were following, and their mental well-being. So respondents reported an increase in the time spent in household tasks, with half of the respondents reporting an increase in the hours spent in cleaning and caring during the pandemic, and close to 40% in cooking. Further, when the respondents were asked about access to necessities, 2 out of 3 reported deprivation and access to medical assistance during the pandemic and lockdown, and 56% in food. Here, while you can see that around 20% of respondents reported a deprivation in drinking water, the percentage went up to 50% among respondents who had to travel more than 300 meters to collect water. Similarly, for food, while the overall percentage is 55%, those reporting deprivation, the share is 3/4 among respondents belonging to scheduled castes, and also 73% for respondents engaged in casual labor, highest among all the occupation groups. Next, please. So when asked about the precautionary measures the respondents were following, wearing masks was the most prevalent, followed by washing hands and then physical distancing. What's interesting is when you see the measures being followed among respondents of different age groups, education levels, occupations, and income groups. By age group, while those over the age of 50 were leading in wearing masks and washing hands, respondents below the age of 30 had a greater percentage of those following physical distancing. By education level, the percentage of individuals following each of the 3 precautionary measures was highest among illiterate respondents. Among occupation groups, washing hands was most prevalent among housewives, while salaried respondents wore a mask and followed physical distancing more than other occupation groups. While these were all over 70%, among casual laborers, however, only about 41% of respondents reported following distancing, only about 43% were washing hands regularly, and 66% were wearing a mask. By income, those with a household yearly income below 50,000 rupees were wearing a mask more than the other income groups, but respondents of higher income groups had a greater percentage of people who were washing hands and distancing. Next, please. Right. When asked about the contributors to stress during the pandemic, for 44% of the women, the cause of concern was losing work or earning a livelihood. Other prevalent ones were the inability to buy essential items and the possibility of a coronavirus infection for themselves or for someone they cared about. The most common medium of information on COVID was word of mouth for about 60% of the respondents, which went up to 80% for illiterate respondents. But for respondents with graduate and higher degrees, the most common source was television or cable, reported by 50%.
Next, please. So taking this background and these findings into account, we arrived at certain policy recommendations for the village makers in Bihar. And while they are among the most adversely affected by the pandemic, their leadership and their involvement will also be the key to recovery. So firstly, investments in and access to basic infrastructure and public services in remote areas must be prioritized by the government. This includes sufficient and affordable water, sanitation and hygiene services, as well as electricity supply. This will also facilitate their paid and unpaid work. The Anganwadi centers must be opened up in a phased manner for feeding and vaccination programs to continue. And frontline workers and educators must be trained to provide counseling and continued delivery of mental health care. Further, the unemployment benefits should be extended to workers regardless of gender and informality of their work. The Prime Minister Garib Kalyan Yojana benefits of food grains and staples should perhaps be extended for another quarter to help the poorer households. The PM Kisan should be extended to non-farmer families, as well as the assistance under NSAP, which is the National Social Assistance Program, should also be extended and increased. Also, in order to ensure that the poorest sections of the population are able to fulfill their dietary requirements, each identified needy person must be provided with $1 a day, which is around 2,000 rupees per month, in line with the Thalinomics that was mentioned in the previous economic survey. And similar to the previous support given by the state government in terms of the distribution of cycles to young girls, it is also imperative to provide a smartphone to each identified family in order to bridge the digital gender gap and divide. And this would facilitate education, digital payments, awareness on COVID-19, and so much more. The distribution of smartphones can either be free or can be subsidized at public distribution shops. Next, please. So to ensure a dignified assistance to the rural women, the state government should provide 2,000 rupees as a one-time COVID-19 assistance to each needy and poor rural woman. If we suppose that the government gives this one-time direct cash transfer to half of the rural women in Bihar, which comes to around 2.5 crore women, it will translate to 5,000 crore rupees. And also, if the state provides a basic smartphone at around rupees 5,000 per phone to around 1 crore targeted needy women, it will translate to another 5,000 crore rupees. That means an outlay of around 10,000 crore rupees should be earmarked and routed to the village makers of Bihar. The state must make ways and means to extend this one-time support, as it is poised to have enormous impact and a multiplier effect in ushering in the spirit of Atmanirbhar Bharat and Atmanirbhar Bihar. Next, please. Right. So additionally, we have used regression as part of our analysis, as we wanted to know some of the causal factors behind the findings. Here we have shown the probit regression estimates. There were many dependent variables, but here we are showing 4. The use of sanitary pads during menstruation, wearing of masks, adhering to physical distancing, and regular washing of hands. The independent variables in this regression were education level, yearly household income, occupation, social group, age group, and source of drinking water, as you can see. Yes, so here you can see when we are looking at the use of sanitary pads by education level of respondents, using illiterate respondents as the base. As the education level goes up, one is more likely to use sanitary pads as a menstrual product. Similarly, by occupation, respondents in salaried jobs were more likely to use sanitary pads. With age, we did not find any significance. But when we look at the source of drinking water, those who had a tap source were more likely to use pads. So we can see that access to basic amenities matters. For the other 3 dependent variables, which are the precautionary measures, we can see the importance of education, among other things. Tap as a source of drinking water is significant for these variables, which are the precautionary measures being followed, especially for washing hands. While the sample was slightly lower, we have still tried to analyze using regression, and more details can be found in the report. With that, I give it to Ritika.
Thank you, Anshula. So when we asked village makers about the challenges they face at different levels, that is at personal level, household level, village level, lack of money and financial problems are persistent. At all these 3 levels, they face this problem. At personal level, they are facing stress due to lack of money, and household level they are also facing the same problem. But the personal and household level, they have the problem of male chauvinism and domination. At village level, they're having the problem of reverse migration, which has impacted their lives and livelihood. When asked about what can society do in reducing violence against women and children, their response was that girls need to be educated, they need to ban alcohol, they need to spread awareness, and they need to enforce laws. I would like to thank our research team for taking this study up and bringing it to conclusion. We also have many qualitative stories, some of which are presented here. This is the YouTube link where we can find these stories. And in the end, on a positive note, with COVID-19 vaccine rolling out, and hopefully we would be in post-pandemic era soon, and not to forget, budget 2021 is coming out. This is the time where we can implement serious reforms for village makers and promise a respectful and dignified life for all rural women in all districts of Bihar, which is their right. We are also having some esteemed panelists from government of Bihar who I hope will definitely consider these recommendations into policy making. We hope to continue with such studies and bring evidence from the field to enable evidence-based policy making. Thank you.
Thank you, Ritika. Can we have the student presentations, please?
Good morning, everyone. So I am ABAT, joining from Tamil Nadu, finally a master's student at the Madras School of Economics, and one of the coordinators on the Telephonic Time Use Survey, Life in the Era of COVID-19, Impact on Women Village Makers of Bihar and Future Prospects. In this modernized and digital world, where we think we can reach anyone across the world, through this telephonic survey, I've come to understand how hard it is to reach to rural women who are less empowered. Collecting contacts of rural women through NGOs, Sahayika and Sevika workers was not an easy task, as most of them were involved in some form of COVID-related works. I take this opportunity to thank everyone who, through their time and simple effort, had contributed to the successful completion of the study. Despite the fact that our questionnaire had around 80 questions, our trained student researchers from various reputed institutes and universities across India skillfully finished their task, which provides us with the data without which we wouldn't be here at this webinar. Keeping in mind the time and the length of the interview, they had to skillfully frame questions to collect maximum information from every response of the respondents. Every interaction with the respondents provided a snapshot of their lives. They shared their stories of survival and success, sorrows and joy, life and death, expectations and realities. All these anecdotes have been compiled to give a general sense of what life has been in the era of COVID-19 for the rural Bihar women. I once again thank everyone who had helped us throughout the survey, our mentors, NGOs, Sahayikas and Sevikas, village heads, field investigators from Bihar, Mr. Pankaj Kumar and Mr. Rajiv Kumar, student researchers, and every members of IMPRI and C3P. And you had already seen the members of this team. Now we can hear from our student researchers, their experience and observations. Firstly, I request Shubhangi Chowdhury to take over.
Hi, let me know if I'm audible to all of you.
Yes, please continue.
Should I turn my video on? Am I visible as well?
Yes, Shubhani. Please
Thank you. Thank you. Sir?
please begin.
Right. Correct. My salutations to the August gathering and the eminent panelists. My name is Shubhangi Chaudhary, and I am pursuing an honors degree in English from Miranda House, University of Delhi. Firstly, I would like to express my immense gratitude at having been given this opportunity of interacting with women from rural North Indian district of Bihar, and through this telephonic survey on the life in the era of COVID-19 impact on women village makers of Bihar and future prospects, I could learn a lot. And although the impediments posed by the novel coronavirus did not allow for a more field-based work, my understanding of people that make up this particular strata of our country has been amplified manyfold and become way, way more refined and holistic through this research endeavor. My area of focus was the distant district of Sitamarhi in Bihar. Having completed the research work, most of us had certain generic observations, the unequal distribution of resources, the male ownership of property, the increased domestic work with the lockdown and every metric imposed after that, declining household savings, these kinds of observations. I believe these observations are to be understood in this particular context, which struck me personally the most. The lack of assurance in the words of these women. And this I would substantiate with the example of this woman from Sitamarhi, and her name is Fulmuni Devi, a middle-aged household worker. About halfway in my interview, I could hear her husband reassuring her from the backdrop that, her answers are correct and that she would continuously wait for this heads up from her husband in order to respect me, to an extent that after a point in time, the husband literally took over the phone and started answering questions on his ownership of tube well and land, bank accounts, etc. And continuously, I interjected him, telling him why it was important for me to talk to his apparently shy and unsure wife. And in the process of reassuring him why it was important for me to interact with his wife, particularly, I actually understood why it was important for me to interact with his wife. And this pattern was a common in my set of responses, particularly. A man would often answer the phone call. They would often tell me and give the permission, quote unquote, the permission to speak with their spouses. And this male ownership of mobile phones, of resources, of numbers registered on their wives' names, this male ownership of knowledge of bank accounts and property, this male ownership of agency and narrative is what struck me the most as a young woman contributing to this particular research endeavor. And perhaps that is the underlying feature of the survey, and I think that is the underlying feature of these forms, because it has an option called not aware. And perhaps what we're doing here is not just collecting accurate, apt data, but also seeing what is the extent of the knowledge of these village homemakers and on whom these households are running, how much do they know? Perhaps that is of essential vital value. Also, the fact that the presence in a domestic space where there is no sense of privacy, no sense of trust, is when you don't get the details very easily. Hence, all the questions on, say, things like domestic violence or caste atrocities against women, which are usually mentioned in the form, these were answered in generically two ways. Either there was an overwhelming affirmation to me that there is no such caste atrocity or domestic violence in their vicinity, or it was just a silent refusal that there was no such atrocity happening in their vicinity. And this is surprising. This is surprising because we know as students and people who learn theory that things like domestic violence and caste atrocities are widely prevalent in these areas. And this is surprising to me. Hence, what could be of help to me particularly was this girl named Varsha. She was the daughter of this Anganwadi worker, and she was about my age. She was pursuing her engineering, and she helped me widely by collecting one set of responses through her mother's aid. And perhaps these women were more comfortable answering it to them in the privacy of their home. Perhaps these are very, very important evidences which help us understand the state of ownership and the state of needs of these women in a much, much, much better way. And the survey captures not only the root of the problem, being, of course, the unequal distribution, the lack of opportunities for these women, but also the effect on these personalities and the personification in the lives of these women. I think this is of vital value. Thank you. Very, very proud to present.
Thank you, Shubhangi. Next, we have Shivangi.
Hi, am I audible?
Yes, yes.
All right. Good morning, everyone. I'm Shivangi Sharma, and I'm a second-year political science honors student at Jesus and Mary College, Delhi University. My course involves subjects like public policy, international relations, and comparative politics. And I've always had a keen interest in public policy, research, and analysis.
which kind of led me to apply to the Impact and Policy Research Institute, New Delhi. With my subjects, I wish to make an impact in the society, and this internship was just a step in that direction. My experience with the research project Life in the Era of COVID-19 Impact on Women Village Makers of Bihar was manifold. Some of the learnings made me understand the ground realities of administration in the Darbhanga district of Bihar in the times of COVID-19 pandemic. I do not think I can minimize the importance of any women rural worker that I interviewed, since each one of their experiences is significant in this project. But having said that, I'd want to highlight one of the many stories that really made me understand the loopholes in the administration process in the district. One of them was an independent woman worker around 28 years of age, a widow who belonged to the scheduled caste and lived with 3 of her children. At the time of the interview, she was living with one of her brothers, but did not even have a clear assurance of what to feed her children for the next meal of the day. She wasn't even aware of the government development schemes and also lacked economic stability. While interviewing her, I realized a number of cases of domestic abuse and violence kind of go unreported in her village. All the women I interviewed suffered from various forms of oppression in their village, and there was a visible intersectionality in their oppression. Conducting the survey made me realize that there was an acute lack of awareness among the women workers about the basic programs introduced by the government. National social security policies were a far-fetched reality for them, as their district also lacked basic amenities such as education and health. With all of this, the survey research project made me acknowledge the privilege I hold and how I should make certain choices to work towards the development of the underprivileged. I would like to thank the organization as well as Ms. Ebi Iti for giving me this opportunity. I would also like to thank my mentors for guiding me through this project, and I have learned quite a lot from it. I hope that this project gives a certain amount of analysis to the panelists so as to implement better policy programs in the process. Thank you so much.
Thank you. So the student presentation is over.
Ma'am, you are on mute.
Thank you so much for this amazing presentation and sharing your experiences, especially young students. Thank you very much. It really throws great light. Now, without wasting much time, I would now invite Dr. Nivedita Haran to begin with the panel discussion and interaction with your opening remarks, ma'am. Over to you, Dr. Nivedita Haran.
Thank you. Thank you, Simi. I should begin by appreciating the good work done by the team of college goers and students, led and guided by their teachers. A good study. A lot of data has been brought out in a very short amount of time, and I think that is very creditable. First thing that occurred to me listening to them over the last half an hour, 40 minutes, let me just put those, flag those points. First, it's nothing new. We know it. We know that there is still a lot of poverty in these areas. We know that there is violence, there is domestic violence, there is lack of empowerment. This is all known. But let me start with the good points. And the good point should be that this is a study on Bihar. Please don't say it's a study on India. I come from Kerala. And I heard a couple of students from Tamil Nadu, and I'm very proud about that. I do a lot of work in Kerala and Tamil Nadu. And I think the situation would be much, much different there. It's not, I think, but I know it's much, much different. Of course, there are other problems, but that's a different story. We are not discussing that now. So this is the story about the state of Bihar and what happened, how the pandemic impacted the women there, the women and children there. The second good point that I find which came out, and I quickly noted that point, is that there is a shift in decision making, and especially it is, I find that, correct me if I'm wrong, even amongst, it's not necessarily directly proportionate to the decision making, to the economic situation of the family. So even in the poorer families, the extent of decision making, joint decision making, has gone up, seems to be higher than it usually used to be, which is a heartening fact. Domestic violence, it was interesting to note that it was more, it did not vary with the economic situation again. So even in families which were well off, the extent of domestic violence was not necessarily much less than families which were not so well off. So, which means domestic violence is not in any way linked to, not totally linked to economic status, which is, I think, which makes it, I say it's a good point because it probably makes it easier to handle than if it has a connectivity to the social and to the economic status. The other thing that struck me was that social discrimination, of course, we know in states like Bihar and UP, Eastern UP especially, social discrimination is prevalent, which when I travel to those areas is quite a shocking thing to me. But that social discrimination is not as much as I would have expected from the figures I saw, was, I think, something good. Now, what I'm saying is, and I hope they are there, what I'm saying is much more relevant for the implementers and the government officials from Bihar, and I hope they are listening. I'm not very sure, but I hope they are. One, a lot of the time when such studies happen, and I have been connected to some of them, one has found that unless one goes after the people who are going to be the implementers, the decision makers, the policy makers, the field performers, the studies remain just on paper. And I would not like this study to remain on paper because immense amount of work has gone into it. And secondly, a lot of important data has come out of it, which should not be ignored. Now, what is it that what I would request the Bihar government officials, agencies from Bihar who are present there, or even the non-state actors who are involved in development and other activities in Bihar, I would suggest a couple of things which may perhaps help them in putting the whole thing together. And I'm sure our panelists would have many more ideas. One, get the crux of the recommendations of this study out. And as you know, in the government, there are, I don't know how many departments in Bihar, but I know in Kerala we have 38 departments. So divide it into the departments to which it concerns, whether it is social welfare, whether it is education, public health, civil supplies and rationing, tribal development. Assign it to them. Specific targets that this is what the study has to say, and give us an action plan that by such and such date you will be able to raise this figure, which is now at a very, depends, at a very high or low level. It should, to improve matters, what can be done. Second, what they could do is take into account what has been mentioned in this study report as an input when their budget preparation happens, which should be in the process of happening now. Third, and this is extremely close to my heart, and I have gone tired of saying this to my batchmates in Bihar and UP, what they should be doing is learning from states like, forget Kerala, because they always say Kerala was much ahead, from states like Tamil Nadu. Tamil Nadu is a state where the literacy level, public health level, immunization level, open defecation levels were at the worst 30 years back. Within the course of 20 years, they have put themselves in the second position. In fact, I would say the top position, if you take out Kerala and Himachal, which anyway were ahead even earlier. Tamil Nadu has done immensely well. It's done unimaginably well. Learn from them. Get an officer from there if you want to, and take your literacy, at least your literacy, to 100%. I say this because I believe literacy amongst the women is the biggest empowerment. Once the women are literate, you will see the impact on decrease in domestic violence, of course, dropout from schools, health, girl-child health, all these, menstruation hygiene, everything will improve once the woman is literate. Second, some very disturbing facts I heard about women having to walk, majority of the women, especially the SC and ST, having to walk a distance of more than 500 meters or something like that to get drinking water. That is unacceptable. That is unacceptable. So ensure that at least these villages, which have the worst of the infrastructure, get the basic necessities of drinking water, rationing system, and toilets. These are the basic requirements of any family, and these should be there. Third and finally, I want to mention that such studies really are eye-openers. The figures really, as I said when I started my talk, such figures are actually known to us. I know that Bihar figures are bad. I mean, it's known to everyone, and I travel there quite often. But such studies are eye-openers, which should put a sense of responsibility and, more important, a sense of shame amongst the public servants and non-public servants. Because this is not just my responsibility. Kerala became 100% literate not because of the government. Let me say that. And that's a different story. We'll talk about that later. It became 100% literate. Tamil Nadu has taken its literacy to 80%, not because of the government, not primarily because of the government, but because of the cooperation from the non-state actors. And that has to happen in Bihar. Where are they? Why are they not doing it? I think I will end at this because I would like to hear the panelists, and I would invite the panelists to make their points. I'm told that you are given the time of 5, maximum 7 minutes. So after 7 minutes, you will be interrupted. So therefore, please keep to the time. And I hope after the panelists have spoken, we'll get some more time to interact. Let me invite the first panelist. The compare, who is the first panelist? Would you invite the person?
Yes. Thank you so much, Dr. Nivedita, for your inspiring introduction. We have now our panelists coming on. So our first panelist is Ms. Mahua Roy Chaudhary. She is Project Coordinator, Governance and Knowledge Management at the Bihar Livelihood Promotion Society, more popularly known as Jivika. Ms. Mahua, thank you for joining us today. And you have heard the presentation from the students, and you have also seen very closely how women have been impacted during COVID times. And we all know how our Jivika Didis have responded and risen to the occasion. Bihar also has the lowest female labor force participation rate, and most of the women are in the informal sector. So in this phase, if we may call it the COVID rebuild phase, how is Jivika actually seeing the pathways towards coming back to a normalcy and women claiming their space as empowered economic agents? Over to you, Mahuaji.
Thank you so much. And I would congratulate IMPRI and also C3 for bringing forth this study. I have several comments to make, and then I would like to then go ahead with my suggestions on the entire study processes and also on the policy level. So the first comment is, yes, the study has come out well, and as we have heard that this is nothing new. But then the figures are extremely, extremely surprising for me, because I see a lot of change happening. So when we started in 2015, in fact, in 2014, when we started working on open defecation free state, only 30% of the households had access to a toilet. And forget about women having access to that toilet itself. And today, your study says that only 24% are going for open defecation. That's a big, huge change. Now, had not the policies been right, had not the policies been pro women, this achievement would have not have happened within 5 years of time. Uh, I congratulate the policymakers of Bihar for achieving this particular aspect. Uh, we see a lot of encouraging results in the decision making processes also, and it varies from on decisions at various levels, either on education of their children or economic steps towards increasing their incomes in the household, and so on. So your studies, the study that was presented today, also gives a very encouraging data out there as well. So the process of women empowerment, or the process of women's role being understood by the government and their implications being seen in the ground is really encouraging. This was not the status even 5 years back when we started working in Bihar Rural Livelihood Promotion Society. uh, these are the 2 points which are very encouraging and needs to be noted very, very strongly out here. The other two things that I wanted to pinpoint out here is that the whole idea of selecting the respondents has somehow left out a lot many women. If you target only ASHA workers and some of the NGOs who are registered under Niti Aayog and their captive areas, you miss out. And I don't think there's a total representation, of whole of Bihar made on the sample size that we are talking about. That's a very critical comment, but why I wanted to make this out is that there are so many other civil society organizations and other organizations working in Bihar, but somehow what we find out in the respondents, those numbers are not represented. Jivika itself, Bihar Rural Livelihood Promotion Society works with 1.24 crores of women in the state, and they are not represented in this study. So it is really surprising at the choice of the respondents level out there. The second is where second thing that I wanted to comment is the infrastructure thing, the banking services thing. They say that 80% of them have a bank account, but still, they are not aware of Jan Dhan Yojana and things like that. Here also, you need to understand here that who are these women? Most of them are ASHA workers who are not engaged into the entire process of SHG movement that's the massive movement that is nationally known, and we are the forerunners in this particular area in whole of the country. So more than 10.18 lakh SHG women, SHGs have been organized in women. So we are missing on this entire social capital that has been created. The point of literacy is takes a lot of gestation period. We don't have that much time. If we have to change that, if we have to see changes in other indicators, we need to work on this social capital. We need to raise awareness through using this SHG platforms, which the Jivika has been able to do over the years. Jivika's role, if you had brought in that particular, some of the cases, how people have been coping up, The whole point, I have seen the questionnaire, but somehow the whole process, the question does not have a, if it is a closed-ended question, the option of taking loans from SSG or taking loans from SH, any MFI is missing out here. And I don't think with Bihar coming up with 13,871 crores of bank credit given to SSG members, this entire aspect is getting missing somewhere or the other. So we need to understand that in the context of the government programs, the study needs to be taken up. The government programs actually, which are not very specific to Bihar, has been tapped. But we need to also understand what are the government programs that are being taken up by Bihar exclusively, and have the questions been framed around that. So we need, Bihar also have given 1,000 rupees directly to the accounts of women here. So that aspect has not come up in that manner. So I would like to suggest that when we are making a study, the representation and the choice of respondents are very, very important. How do you choose the universe is very, very important. The research outputs are very good and it is thought provoking, but somehow I would suggest that the universe selected could have been more robust. I would stop here. Thank you.
Thank you, Mahua, for your thoughtful observations and listening very carefully to the presentation. I'm going to research team to respond to your query as to the choice and selection of the research universe and the sampling. This was a telesurvey, as you already know. But I'd like to invite our next panelist, Professor G. Sridevi, who is Associate Professor of Economics at the Central University of Hyderabad. Ma'am, while we listen to your response to the presentation and the key issues and findings that have been presented by the young research team, could you also respond to how the COVID situation has impacted the lives of Dalit women? We know how as always in any disaster, those living on the margins suffer the most. But if you could add some observations around those as well. Thank you. Over to you, ma'am.
Yeah, thank you so much. It was very interesting, and I mean, all of you have put a lot of effort in collecting the various indicators, which basically explain the different impacts on women, considering all socio-economic and the political factors also. And basically, the most important aspect is role of the state, what way the state plays an important role during the times of distress as well as the disaster management situations. If we look into the Indian situation, the socio-cultural norms basically prevalent in rural areas have prevented women from having the equal rights to have access to education, access to land, and most importantly, in decision making at the household level. And if we look into the political scenario, although given the panchayat reservations existence and all that, their representation is in terms of decision making is very, very low. Although as elected members they are seen, but their representation in terms of decision making is very, very low. So as a result, women are always underrepresented in various walks of life. Although 55% of the female members coming from the various social groups, according to your own study, are working in the age group of the 15 to above 50, working in the different aspects. But still, they do not have any economic say. So economic empowerment and change in the societal patterns have made the women actually question established norms that have been imposed on them for the centuries. But when they start questioning the domestic violence as well as the atrocities would be rising. If we look into the Global Gender Gap Report of 2020, it very clearly says that it will take 95 years to close the existing gender gap in political representation. And if we want to have the economic parity or equality, or to reduce the gender gaps in economic aspects, it will be taking 257 years. So that itself explains the kind of the inequality existing within the society. And so that itself leads to the women receiving the differential treatment during the pandemic action. So women at global level constitute 2/3 of the global workforce in the health sector. But interestingly, there is a huge pay gap between the men and women. But if we consider the pay gap in terms of the Indian context, it is 35% compared to the global average of the 16%. Even in your study, it is very clearly reflected that there exists the gender gap in rural villages. Even as per the CMI IEC Consumer Pyramid Household Survey reports also, the job loss of the women is very high when compared to the men during the pandemic situation. Now, we always assume that certain states are doing extremely well. Certain states are not doing well. Agreed, there will be different levels of the political, economic factors influencing these states to perform better. While giving the remarks, Chair Dr. Nivedita was trying to say that Kerala is doing extremely well. But we did a study in Kerala in terms of the women nutrition and then poverty among the various social groups. We find a different set of the facts at micro level. Even there is a difference in terms of the literacy. I think currently it is 91.2 or something is the literacy level of the females, and 96.2 or something is the male literacy levels. But when we looked in terms of the access to the nutritional security in Kerala, Wayanad district and Trivandrum, it is surprising that many of the women and children belonging to the age group of below 5 years, especially coming from the marginalized group, scheduled caste and scheduled tribes, suffer with acute malnutrition. And the other important aspect, although we studied two different districts, even NFHS 5 report, the initial result which was released few months back, also shows that compared to NFHS 4, the malnutrition levels in Kerala has gone up. And there is a gap between the various social groups. Bihar, UP, and then Telangana, which is newly formed, also very clearly shows that the malnutrition levels of the females have gone up, and the anemia levels, all kinds of anemia levels have gone up these states. But when we look in terms of the per capita incomes, they try to perform well. But when it comes to the equal access to the resources, they are not able to be provided equally to all the sections of the society. Now the question is, when there exists social inequality, without addressing the social inequality, can we able to talk about the economic equality and political equality? So we need to address the issues related to the social inequality, then it will automatically lead to the reduction in the economic and the political discrimination what women in general face, because within the gender, the discrimination levels are different for the different social groups. Let us all agree that although mainstream economists and the feminists say that women are women as a one group, no, it is entirely different. The access to the resources for a for an upper caste woman or a dominant community woman is entirely different from the Dalits and the marginalized group women. What is the role of the state in...
Professor Sridevi, could you wrap up in another minute?
Yeah. So the most importantly, providing access to education, and the self-help groups play a very crucial role. Like in Andhra Pradesh, the majority of the self-help groups try to perform very well, and the state emphasizes on the role of the woman. And now the state has also introduced a special kind of a program where female children are given the every year 15,000 once they're going to the school. So these kind of benefits will automatically help the increase the participation rate of the women. I think by considering this, I say that women should be provided first the resources in terms of education, access to land, and strengthening of the self-help groups would be helping them in a better way. Thank you.
Thank you, ma'am. Thank you, Professor Sridevi. We now go to Mr. Braj Kishore Pathak. So if you could turn on your audio and video. Mr. Pathak, if you're there.
Thank you, madam.
Yes, sir. So we have Mr. Braj Kishore Pathak. Yes, sir. Let me just introduce you. Mr. Braj Kishore Pathak is Officer on Special Duty, Bihar Rural Livelihoods Promotion Society. And sir, if you could provide your perspectives on the study, and also really focus on the fact that male migration in the pre-COVID times and the return migration during the COVID times and lockdown, it has added to the financial miseries of families, especially of the women. So if you could highlight some of the key participatory tools for engaging in discussions with the families to accept the quality of household decision-making and contribute to the emergence of strong social networks and support systems for women. If you could throw some light on these. Thank you so much, sir. Over to you, Mr. Pathak.
I mentioned in although I do not refute the survey done by the young students, it is sure that some important and vital issues have not been taken into account, as mentioned by Mahua. In fact, now in Bihar, it is female who have emerged as change makers. Bihar has been providing services as NRO in a number of states, including Rajasthan, Uttarakhand, Uttar Pradesh, Jharkhand, and Northeast states. However, points that have been mentioned, we shall take care with regard to migrant laborers. It is a fact that migrant laborers were so many in number that came to a state in course of lockdown, and they had faced immeasurable trouble while returning to Bihar. But after they returned, care was taken for their proper quarantining. Their service they were provided good quality food, and appreciate the point that COVID cases in Bihar were not so alarming as its a population, and now almost 99% of them have recovered. So state took all measures, and during the period of COVID, a huge number of 18 lakh ration cards were prepared and delivered to the households with another 1,000 rupees per household. This was done with the help of our women workforce, the Jivika women workforce. And they have been still providing their services. They prepared over 3 crore However, state government is very much careful, and we are also doing our best to provide livelihood so that there is no further migrant laborers. There is no possibility of our labor going outside. They get employment in their own houses. In fact, after their coming, we have provided livelihood options to them. A number of them are engaged in the skills that they have earned elsewhere, and they are using it for the benefit of Bihar, and we shall take care that in future things are streamlined. Thank you.
Thank you, Mr. Pathak. Thank you for your comments. I now invite Professor Nalin Bharti, who is professor at Indian Institute of Technology, Patna, to make his remarks. Sir, if you could also throw some light on how the gendered division of labor, it has been detrimental to the physical and psychological growth of women. And it is unfortunate that, they are not yet counted as farmers. While in the study, there has been an overwhelming evidence that shows that women are responsible for managing and even growing crops. So if you could really, talk about a little bit on this front as well. Over to you, sir. Professor Nalin. Professor Nalin, can you hear us? So you're not audible.
Hope I'm audible now.
Yes, audible.
Yeah. So I am logging through two different accounts, one from the mobile, one from the computer. So through mobile, my visual presentation you are able to see, and through my audio you are able to see my voice. So thank you very much for this very timely study, that too in a condition when the entire world was under pressure. You have studied a state which is one of the densely populated state in this country. The population of Bihar is close to the population of Japan and population of Bangladesh. So the study of Bihar is in a sense, it is important that it is not only the study of a state, but it is also the study of one of the ancient, the place where one of the ancient democracy, the world first democracy started. And even at that time, when the world has noticed and acknowledged the first democracy of the world, it was driven by the women in Bihar. So having the very rich history, I have 3 points to mention today. These points are, the first point is the definition of migrant worker. The second point is the connecting growth and development. And the third point is the pandemic. So let me first briefly discuss the point migrant worker, for which you people have done the work and you have interviewed those workers. But I am not really agreeing with the concept called migrant worker, because I am basically working in the area of international trade and investment, and I was looking the definition of migrant worker and how other countries are treating migrant worker, how other countries are treating workers, in which category they put workers in the migrant category. So it is really surprising that the country like Japan or the Singapore, they don't treat their own people, their own worker as a migrant worker. India treat our own workers and laborers as a migrant worker. So one of the professor of literature was discussing on the migrant workers condition during pandemic, and I was listening his talk, and he was mentioning that if the chief minister of Bihar will visit Delhi for 3 or 5 days, will he be treated as the migrant chief minister? So the whole concept of migrant worker is having a technical fault. So I must mention here that in your report, or the people who are associated with the Ministry of Labor, they can also change the concept migrant workers. So why I'm mentioning, the moment you will say migrant, the moment government of Bihar, the moment government of UP, the moment government of Delhi or government of Maharashtra will treat their own worker as a migrant worker, you are completely disassociated at that moment itself, psychologically. So you have to rethink. This pandemic has given us an opportunity to rethink about the concept of migrant worker. And I was also listening some of the secretaries from Kerala during the pandemic, and they were mentioning that they have treated workers coming out from different state as the guest worker, atithi shramik. In our own country, we have a different model where they treat, and the treatment is treatment of the workers coming from other states in Kerala was really appreciative. It needs lots of appreciation, because it is the worker, basically it is the worker who are really involved in varieties of jobs, activities. They are basically leading the economy on the growth, on the path of growth. So that is my first point, on which there may be a discussion, and the participant and people who have done this survey, they can also see the migrant worker and the entire concept of migrant worker. The second point is, Bihar is one of the fastest growing state in last many years. And I am one of the person who has seen this growth rate in Bihar personally from 2008 to 2020. So I was a little bit surprised after going through some of the data on debt, some of the data on non-farm activity, some of the data on income. So I was thinking, and as Mahua pointed out, that some of the major features which Bihar has covered as a part of development has not been captured in the study. So, but still, I feel the growth which Bihar has achieved is not being transformed into the development. So there is a disconnect between the growth and development. Even though this study is very small, it includes only very small size of sample, but still this study gives us this conclusion that the connectivity between the growth and development is not up to the mark. So whether it is a toilet facility, whether it is a sanitary napkin, sanitary pads use, or health facilities, or the income level, or the debt condition, or the below 50,000 annual income people. So all these statistics allow us to rethink that the highest growth of a state, why even this highest growth of a state is still struggling hard to control some of the development parameters. So this is my second point, and the report can also link on this aspect. My third point is the pandemic. we have seen that not only Bihar, but other states also, the entire country, we have seen a very different face of police, very important role done by the police people. The entire task of uh, uh, providing medicine, reaching somewhere where the needy people need some medicine or some help, or putting them in the hospital, uh, meeting all the migrant workers coming from different states, and they are receiving on the station, again, providing them food, transferring them from stations to the village, again taking care of them at the village level. There are tremendous tasks the state has done. I must say the entire responsibility of the state after the independence. It was the first time when the pandemic has proved that the state of India is, or the various state is more powerful, especially in a pandemic situation. They are more active. Various departments were active, whether it is PDS, whether it is police. So we have seen a very different face of a state that was impossible to see, because the crisis only tests the efficiency of the state. And
Professor Nalin,
yeah.
if you could wrap up
Yeah.
in one of.
So this pandemic has proved that the role of a state, whether at the central level or the state level. So while capturing the data in Bihar, probably you might be knowing that 1,000 rupees was transferred from the government of Bihar to the migrant workers. And at that time I was in constant touch with some of the officers in Bihar, and they were mentioning that this linkage of Aadhaar with the bank account helped a lot. And hardly 10% of the workers were not having the account which was linked with the Aadhaar. Majority of the workers were having the bank account linked with the Aadhaar, and that was the only in that pandemic situation. So there are many merits of this study, but bringing these things at a very larger level, where we can really consider migrant worker as a migrant worker, whether we can also see growth and development connectivity in this report, and also finding pandemic as a testing time for the state. These things may improve the quality and of the report, and I wish that under the leadership of the director of IMPRI and the associated people of this report, and I was also associated with this report, and I'm really sorry that still we are not having the full-fledged student joining IIT. We are still not allowing the BTech student to come. Otherwise, our own student would have been participated to do some study at some district. But still, we feel that the study pointed out many important features which can add the current development policy of the Bihar, and the state and the policymaker can take many lessons. Thank you.
Thank you very much, Professor Nalin. So we are through with the first round, and we are really exceeding the time. But Dr. Nivedita, may I take your permission to invite Dr. Arjun to respond to some of the comments that have been raised, and then maybe after that you would be able to better comment. Yes.
Sure.
So Dr. Arjun, if you could, yes, please.
Yes, thank you. And I really also invite Nalin sir to have students from IIT Patna also in our future studies also. Sir really helped, and also helped from other educational institutions, IIT, ADRI, and also Reena's ma'am college. So many colleges, also diverse institution of Bihar we tried to cover. And also but I would just like to also mention, as Dr. Haran really mentioned in her starting comment only, that we all know these things. And what also Mahua ma'am was saying that over the years, be it housing, be it sanitation, be it various other things, there has been a rapid changes in terms of access to basic amenities, financial inclusion, other things. Also in Bihar, Jharkhand, all the eastern part, in Bangladesh also, so many models coming. And in terms of sample selection and universe, the telephonic rural studies, which we have tried to do, especially looking into the time use. Many such studies you can find like Azim Premji University. They really focus more on employment. We have yesterday a lecture from Dr. Amit Basole also. So these are really purposive study, and we try to gather stories and some numbers from all the districts of Bihar through various channels. Like for example, Nalin sir is there, so that academic connection, Reena ma'am, and we also have various civil societies, C3's organization also many Jivika and other panchayat number, various all these details are there in our report. One can see standard practices which students can emulate. And but I would also like to add that the we have gathered around 1,000 responses, but the amount of struggle one has to do, you call 8 people, 10 people, then you are able to take one interview. So really, we have tried to, within the span of 1 month or so, within that time stamped interview, we have tried to cover. Our students have really happened to try to reach out to many people, but in terms of responses, some have come. And during this activity, various flood situation, other stories were also coming, migrants and many things our panelists have rightly raised. So those things are also coming, but the results really which are coming. And I would also like to mention, as our panelists from Jivika were also highlighting, that SHGs and other things, those dimensions also in financial we have asked, and those things have come. Bihar has around 10 lakh SHGs, 60, 70 lakh rural women also associated. And from the example of Tamil Nadu, Andhra, Kerala, South India, and West India also, the role of SHGs really need to strengthen. And the final point, which I also wanted to touch upon, that yes, Jivika and also Bihar Rural Livelihood Promotion Society, as other states also, now has become a really good institution. Like Nalin sir was also saying, that the state has become and proven to be strong, meticulous, one can do something. And we also asked this question of cash transfer, many have come. But what we really wanted to highlight, as Sri Devi ma'am was also highlighting, that who are excluded. We really highlighted that the casual labor rural women are really getting excluded, Aadhaar linkage, other issues, many things also coming. And Dalit women also, so many deficiencies. So who were excluded was really the part we were trying to highlight, and who needs to be targeted. The 1,000 cash transfer which went there, but what our study is now suggesting, that Bihar's budget is also coming. So, and a few people really need assistance, and those who are marginalized, we are suggesting that within this, for January to March, a cash transfer to those who are needy, 2,000. 1,000 we gave really last year. That was a very good move. Some because PDS and other things are going, cash requirements, students also, children, and also to further target some Android device for education. That was the really highlight our study was trying to make. And also the financial outlay also, we calculated that around 10,000 crore, if that goes really targeting, so other people will also benefit and strengthen the cause for the real development of Bihar. So that was, I think, all the points I wanted to cover. We can go once again for any specific point.
So actually we have exceeded our time, so we don't have much time left. So if we could quickly go to Dr. Nivedita for her final comments, and then we could begin with the certificate distribution.
Thank you.
Yes,
Thank you,
Nivedita ma'am.
Yeah, I will be very brief, but I thought I need to touch upon a few issues, and I'll do that. The pandemic has really, it was not just a public health and a health crisis, it was also an economic crisis. And the impact it had on the social in creating a social crisis and magnifying certain social problems should not be lost sight of. A lot of issues that were mentioned today, I think they have a lot of importance. For instance, the impact on land title, and I have a lot of questions on that to Bihar. What is happening to FRA? Why is it that the ST families are still without land? You see, land title. And why is it not given in the joint name? You know, a lot of issues have been brought out by this study, and we should not take amiss. The point made that the selection of the respondents was probably not very representational. I would say that even if it is correct, probably it was for the better, because the study has somehow managed to reach out to the poorest of the poor. And from my experience, I find the most difficult to handle are the lowest 15%. They are the most socially marginalized, economically weak, as well as in every way they are left out. And they always, even if there are projects and plans, they always manage to be put into the gap where they are not reachable. The reason being, and I'm a public servant, I have been a public servant, and I can admit the reason being it's the most difficult to reach them. It's very easy to reach the top 80% of the socially backward. But when it comes to reaching the bottom 20%, it's the most difficult. And therefore, if the study has brought this out, take it in the right spirit. I would exhort the representatives of government of Bihar or the other agencies present here, take it in the proper spirit and improve upon it. Reach out to the poorest of the poor, because they are the ones who need to be reached out to. Very good point made by Dr. Sridevi, Professor Sridevi. I agree, Kerala has its problems, but you know, the kind of gut-wrenching poverty you see in Bihar and UP, you will never see in Kerala. But we have the problem of malnutrition amongst women, anemia amongst women, social inequalities in certain groups that are coming back. So we have our problems and we need to address them. Point well taken. The point which was made that the self-help groups, the Jivika groups are doing well, that's a very heartening thing. Because again, and I have to correct you on that, Mahua, the self-help group movement of women, and then Kerala took it up through its Kudumbashri project, and now it's moved to Bihar, Maharashtra, and certain, even Rajasthan is doing quite well. So SHGs having been set up, activate them. Are they functioning with thrift societies? Are they going into livelihood issues of women? Are they looking into literacy? And trust me, literacy is not a long-term project, as you said. It can happen in a year if you make up your mind. What are the IITians doing there? What are the centers of higher learning doing there? They should do it. And the government should take them as their right-hand people. Self-employment. You say that all the migrant laborers who have come back through reverse migration will be provided with self-employment. It's not possible. I know. I work with the migrant labor from Bihar, including Bihar and Bengal in Kerala. And they have almost 80% are wanting to come back. So how do you deal with them? Dr. Nalin, Professor Nalin, you raised some good points, but you know, you said that why call them migrant labor? That terminology, you have something against it. But what is in the nomenclature? My question is, do the laborers who come from Bihar and Bengal to Kerala get the minimum wages in Kerala? Answer is no. Do they get the benefits available to other laborers in Kerala? Answer is no. Can they become members of trade unions and political parties? No. So then such people who don't get those benefits are called migrant labor. What's wrong in that? I think that's one way to draw attention to them. And that's what we try to do. I'm part of an organization called CMID in Kerala, Center for Migrants and Inclusive Development. You can check them out. We are doing some good work with the migrant laborers in Kerala. Finally, I want to mention, and I said it already, I want to conclude by saying that the pandemic has opened our eyes to certain problems that have got magnified due to the pandemic. These are economic issues, these are health issues, these are gender-related issues, and these are social issues. Let's address them. The study pertains to Bihar. Doesn't mean that the problem is only in Bihar. It's there in many places in a variant form. But let's address them in Bihar because that's what we are discussing today. And if you could do it, SHGs could do it. Let's bring that change. Let's make these SHGs, the women's groups in rural Bihar, the agents of change that would change the face of Bihar. That would be a real change. And I'm saying this directly to Mr. Pathak and to Ms. Mahua. I think I'll stop here. I'm available. If any of you want a discussion or any advice or any suggestion or my involvement, I'm available because I do travel to Bihar a lot. Over to you, Simi.
May I come in for half a minute because I just wanted to make a point.
Please, please.
Just half a minute. One is that 1.24 crore women have been looped into SHGs in Bihar. No other state has this number. So it's not 60 to 70 lakh women, it's 1.24 crore women. And that is how we have surpassed all the states in SHG movement. That is what my point was. Talking about other social aspects, Jivika women, it was because of the Jivika women that you have total prohibition in Bihar. So they are moving towards social change as well. So what I was trying to point out here is that this change, somehow I do agree that all economic change or all growth do not translate into social change as well. But this entire journey or this processes gives a very, very, very interesting change that is also being represented in your studies. So we need to acknowledge that, and always we need to say that it might giving policy changes recommendations is very easy, but do we really require 2,000 rupees transfer, cash transfer, and to what level? And another thing is, for the extremely poor people, Bihar is the only state which has the Satat Jivikoparjan Yojana. That's the graduation approach for extremely, extremely poor people. I don't think any other state has it. Abhijit Banerjee's concept has been taken up and we are moving towards graduation model. And here also we are targeting 1 lakh extremely poor people. We are also trying, and there are several indicators where we are trying to see whether the SC and most vulnerable people are included in the SHG fold or not. If they are not, they are part of SJY, that is Satat Jivikoparjan Yojana or not. So the targeting of the very poor people have already started. The state is taking very many steps, and I think we need to acknowledge that. The change cannot be seen overnight, but you need to give real good time to see the the absolute figures changing. So you need to acknowledge that. You need to understand Bihar first, and only then maybe make policy recommendations. Thank you.
Yes, very valid and pertinent points.
Dr. Arjun, as an economics person, when we just say the number of
really short of time, so if just half a minute of your intervention, and then we have to.
Yeah, exactly. So when we are talking about the number of people, women involved in SHGs with comparing with the different states, we should also take into consideration the total population of the state. Bihar is the largest state and it has the largest percentage of the women. So what percentage of women is actually involved in SHGs is more important and actively participate.
Also, Bihar is also dense villages also. Because if it would have been Kerala, it would have been a city. Kerala is really more urbanized. Anyhow, but the point really ma'am was making, really right, those models also. We really, in terms of rural areas, really highlighted that PM Kisan is also there, so many schemes. But given then, there are some people also in our survey, most have also asked for cash. And this remains, ma'am, 2,000 to be given in 3 months, or 1,000 or 520 rupees, half a liter milk comes. So for even half a liter milk every day, other than PDS or what support, we are giving 600 rupees. So what can be a good amount? Also looking into the state of public finances, really very important point. And I'm sure that Bihar government to take this call and move using any policy lever to impact those who are suffering in this pandemic. A very nice point. Thank you, ma'am. Shall we move to the certificate distribution so that, yes, we remain almost like time also.
Can we have ma'am, Dr. Aparajita Gogoi, if you would like to come up, and if you have a minute or so of comments to make final remarks, and then we can go to the certificate distribution.
Well, nothing much to add. I think we had a very interesting discussion and points kind of well taken, that this survey finding is pointing out to certain kind of action that we need to take. But we also realized that the actions that needs to be taken has to be contextualized. We have to look into aspects which are working very, very well, and really work on how do we build on the aspects that are working, and if there are gaps, how do we build on the gaps. So I'm going to stop here because a lot has, very important ideas and opinions and views have been shared. So thank you so much for all the speakers and Nivedita ma'am.
Thank you so much, ma'am. So, ma'am, Dr. Gogoi, if you could, what we have is the certificates on the screen, and we would request you to, for the next 10 certificates, if you could just read out the names, and that's how we would do the virtual distribution. So it's on the screen now.
Sure. And maybe, one of you or Dr. Haran can also join.
Yes, after next 10.
Yeah, so I'll do the first one. This is the certificate of appreciation for Mr. Nikesh Kumar, who was part of the survey. Congratulations. The second one is for Ms. Shivani Rathore. Congratulations, Shivani. The third one is for Dr. Amar Gupta. Congratulations, Amar. And the fourth one is for Dr. Binit Surana. Congratulations, Dr. Surana. Then Mr. Prabhat Ojha, congratulations. Ms. Manya Agarwal, congratulations. Ms. Samiksha Suryakant Parab, congratulations. Ms. Yogita Chandane, congratulations. Ms. Joshna, congratulations. Mr. Chandrasekhar Upadhyay, congratulations. Ms. Aishwarya, congratulations.
Can we have Dr. Haran to distribute the certificates? Dr. Nivedita? Yes, please.
Yeah, this is for Ms. Tanya Chaudhary. Well done, Tanya. Mr. Hridaynath Sudhir Sonune. Ms. Shivangi Sharma. Rupesh Kumar Jha. Shubhangi Chaudhary. Rajiv Kumar. Pankaj Kumar. Acharya Rupesh. Tanya Agrawal. Sunidhi Agrawal. Gabby Atty. Ebi Atty.
Yes, ma'am, we're done. Yes.
I hope all of you, congrats to all of you, and I hope you all take this as a lesson learned in life and build on it. Congratulations.
Thank you so much, Dr. Haran and Dr. Gogoi, for your wonderful time, and to everybody. And if I can invite Dr. Arjun to propose the final vote of thanks. Dr. Arjun.
Yes, thank you, Simi, and thank you, everyone, to gather here and discuss on this very pertinent issue. Details also we will bring out in a report form for everyone to benefit, and as our chair also mentioned, that to call out department-wise finding and also to inform what we have done. So we will also do that and take this debate and deliberation further to learn more. And also, so very happy that so many students were able to complete it. I would say 4 times that have also tried to do it, but they also participated, and also help in calling out various phone number, reaching out to, and also talking to many NGOs and other things also. We will all bring that in the report. So let me thank all of you, and from C3 and from IMPRI team, all the study team, and all our panelists today, and also our chair. So thank you so much, Dr. Nivedita Haran ma'am, for chairing this session and really enlightening us on all the issues. We really wanted to have the focus not only on Bihar, but also learn from other states as well. So thank you, ma'am, for really contextualizing all the changes which is happening and touching upon this issue. And really thankful for Dr. Aparajita Gogoi, ma'am, to come here and also share her views and spearhead this kind of study, which really informs and also update all our students also to have hands-on practice, dwell into these issues, and also thankful to the Gates Foundation Sakshama initiative at C3 for helping us and also funding us for this study to take students even in the tough time. Many students also got COVID and their parents also. But we try to do it, and the other technical issues I think always remains even with the NSS data. Any data we talk about, that things always remains and never, but really good effort. And we are really thankful to our panelists also today to contribute to the deliberation. We will incorporate all the points and also update our study with the new numbers, other things, and how we can also improve. So thank you so much, Brajesh Kishore Pathak ji, for joining us today. Also Mahura Chaudhary ma'am from Jivika, Bihar. Nalin Bharti sir from IIT Patna. Thank you. And sir's comment about migrant workers, it needs, I think, series of webinars. Very deep points. Sridevi ma'am, thank you again for highlighting all these points and taking out time. And but no students from Hyderabad in this study. Next time we will try to have also from University of Hyderabad. Thank you. Our moderators also, Dr. Sim Mehta and Ms. Madhu Joshi ma'am, thank you. And last but not the least, I would also like to thank Devki ma'am from C3, who has communicated, and she has worked a lot on this project. So thank you, ma'am. I really thought also to have you and also have some, in fact, she should be giving the vote of thanks. So anyhow, it's almost lunchtime. Thank you, everyone. And I think we will all learn more on this issue and take the conversation forward. Thank you. Have a good day.
Thank you.
Thank you.
Thank you, everyone. Thank you. Have a good day.
Thank you so much.